Good afternoon, everyone. Welcome to our webinars by LAMP on TCM. Let's start the ball rolling with Ma'am Neets Yu, certified acupuncturist from Quezon Province. Good afternoon, Ma'am Neets.
Good afternoon, everyone. Good afternoon, Doc Hector. Today, we'll discuss lung basics, blood, class 3, part 3. Okay. Blood is a good example to illustrate the duality of yin and yang. Blood is yin because it is fluid, it carries nutrients, it nourishes the whole body. Blood is yang because it is flowing, it circulates warmth, and any part of the body that does not receive blood would become cold. If any part of the body has excessive heat and has no possibility to control this heat within, then it would need to expel it outwards. The quickest and most efficient way to achieve this is by bleeding. Bleeding releases and reduces heat. Bleeding. Okay? So this is the illustration of the kung paano nagtatransform at nagtatransform from food and the drink, kung saan siya napunta, sa stomach, and then yung sa spleen, magkasama sila, at saka yung kidney or bone marrow, with the air, sa lungs, and the heart. So dito mamaya, iaano natin sa next slide, i-explain po. Okay? So, blood metabolism or blood zoo. The above picture shows the roles that different organs play in blood synthesis. The stomach receives nutrients and fluid from what we eat and drink. These are digested and separated into pure and impure substances. The spleen absorbs the purer form of nutrition and stores some of it. It sends the rest of the absorbed nutrition down to the kidneys. Yung kidneys naman make bone marrow, which make blood. This blood is without nutritional value and is called white blood or plasma. Nutrients and fluid from the spleen and the white blood to the lungs. The lungs also contribute to the nutrition of blood by breathing in oxygen. Thus, all the necessary nutrients reach the thorax, and red blood or the oxygenated blood is synthesized by the heart. Okay, yun po yung explanation ng picture na yon. As we can see, anemia or blood deficiency may be nutritional problem. Yun yung iron deficiency. It could also be due to many other reasons. The most obvious being weak heart yin and yang. It is called heart blood and Qi deficiency. When treating, it is necessary to tonify both the yin and yang aspects of the heart, improve nutrition, and use master points. Remember these points. UB17 for blood and GB39 for bone marrow. Okay? The liver is an organ that holds the blood within the vessels and within itself, thus governing, storing, and letting go of blood through the bleeding. Liver yin stores blood and liver yang releases the blood. Okay? This patient has thin blood. Ito yung towergram. He does not bleed spontaneously but has problems with blood coagulation. If the patient had an injury, he would continue to bleed. Maliit. Hindi sila pantay yung yin and yang niya. Yung mataas yung isa mababa. So, ito naman sa second towergram, in this case, there is a tendency for spontaneous bleeding as the liver yang is high and it releases blood. Okay. The next towergram, spontaneous and excessive bleeding. This is the worst combination that there could be the liver. On the other hand, the yang wants to release the blood out of the vessels. On the other, the yin cannot store it in the vessels. Okay? Ito naman yung last towergram, yung parang tuldok-tuldok. There is problem. So, may problem related to release of blood when it is necessary to bleed. For example, menstruation. Okay? Women with liver Qi or function deficiency often suffer from dysmenorrhea at onset of menstruation until the blood starts flowing freely. The blood tends to stagnate in the uterus, thus causing severe cramping pain and dark clotty bleeding. With all the cramping and spasm, the liver chi eventually improves enough to release the blood flow, and this eases the pain. The dark clotty bleeding suggests liver blood stagnation because of chi deficiency. Okay? Thank you very much for your attention,
Thank
everyone.
you very much, Ma'am Neets. We now proceed to the second topic. Let's listen to Ma'am Teresita Sumile for body fluids. Good afternoon, Ma'am Teresita.
Good afternoon po, Dr. Hector and classmates. Continuation po ito sa body fluids. The same basic principles. Relation with internal organs. Now, we'll start from the spleen. It is the most important organ in relation to physiology and pathology of body fluids. It controls crucial direction of moving pure and impure fluids upwards and downwards, respectively, at all stages of body fluid production. So for this reason, spleen is always treated in any disorder of body fluids. Here, makikita natin na the spleen transforms and transports fluid, body fluids, and then the lungs diffuses body fluids, then kidneys transform and separate and excretes body fluids, and then the bladder excretes body fluids, then the triple burner transforms and transports and excretes body fluids, and then the stomach is the origin of body fluids. Okay. Next is the lungs. Control diffusing of pure part of body fluids coming from spleen to space under skin. That is lungs diffusing function. Then it sends some of fluids down to kidney and bladder. That is called lungs descending function. Because of these two functions, lungs are said to regulate water passages. Next is kidneys. Vaporize some of fluids they receive and send them back up to the lungs to moisten lungs and prevent their getting too dry. Kidney yang is extremely important for transformation, separation, excretion, and of fluids. They provide the heat necessary for the spleen to transform body fluids. For this reason, a deficiency of kidney yang nearly always results in a deficiency of spleen yang with consequent accumulation of fluids. They assist the small intestine in its function of separation of body fluids into a pure and impure part. They provide qi to the bladder for its function of qi transformation. Then they assist the triple burner transformation and excretion of fluids. Next is the small intestine. It separates fluids. It receives from stomach into clean part which goes to bladder for excretion as urine, and dirty part goes to the large intestine partly for reabsorption and partly for excretion. Small intestine function of separating fluids is controlled by kidney yang, which provides qi and heat necessary for this separation to take place. Okay. Now, so we have here an illustration on how small intestine fluids it receives from the stomach is separated. So small intestine fluids are composed of turbid and clear fluid. Now, The turbid fluids goes to the large intestine partly for reabsorption and partly for excretion in a form of stools. Ang clear fluids naman goes to the bladder for excretion as urine. Okay? Next is the bladder. It separates fluids it receives into pure and impure part. Excretes urine by power of Qi transformation. Next is the triple burner. It assists transformation, transportation, excretion of fluids at all stages. In charge of irrigation, controls water passages. The middle burner assists stomach in its function of churning fluids, directing impure part downwards. For this reason, middle burner is compared with muddy pool, that is stomach function of rotting and ripening. Lower burner assists small intestine, bladder, kidney, and their functions of transforming, separating, excreting fluids. For this reason, lower burner is compared with drainage ditch. Next is the stomach. Stomach is a source of body fluids. Then, fluids first enter the stomach and from there are transformed and separated by spleen. Likes to be moist, in contrast to spleen, which likes dryness and is damaged by too much dampness. It easily suffers from excess dryness, and this can lead to stomach yin deficiency. It is wet, slippery foods, rice or oat porridge, like rice or oat porridge, are beneficial to stomach. Excess of very dry foods, like foods roasted or broiled for a long time, may damage stomach yin. Thank you so much for your attention.
Thank you very much, Ma'am Teresita. Next, we have Sir Dino Pinero for the Yin and Yang philosophy. Good afternoon, Sir Dino.
Good afternoon, Doc. Good afternoon po sa lahat. Okay, we have the yin and yang, the duality of all things. So, the functional Qi deficiency in an organ will lead to retention or stagnation of fluids and stool and poor digestion and incontinence. So, yan po yung functional Qi deficiency. Whereas pag deficiency naman of warm yang would cause coldness. Yin also includes blood and fluid. The term blood refers not only to red blood itself, but also to the nutrition in general. In nutritional deficiency, this could lead to weakness, tiredness, and poor endurance, paleness, and coldness. So pag deficient yung blood, ito po yung mga nangyayari. Sa yang function of the spleen, this one transforms and transport food Qi. So sa kabila naman, blood, which is yin, and represent the yin part of the spleen. The continued lack of nutrition fails to nourish the functional Qi of the organs. This means that a deficiency in the blood naturally leads to deficient Qi. So, ibig sabihin, deficient yung blood, magkakaroon din ng deficiency ng Qi. But when the yin is deficient, there can be dryness without nutritional deficiency. So, pag yung yin, yung fluid part, ang deficient, there could be a presence of dryness pero hindi apektado yung nutrition. This could lead to a heat symptom as yin is unable to control the yang and hyperactivity of organs. So pag yin deficient, there is a presence of heat. So may mga heat symptoms po siya. Example, a woman secretes less female hormones during menopause. So pag menopause na po, less na po yung hormones na naproproduce, one could say that she is therefore less feminine or less yin. And this causes general dryness in her body. So since there is a yin deficiency, this result to having heat in the body, kaya nagkakaroon ng dryness. At the same time, she also suffers from heat symptoms. So yung mga heat symptoms niya, meron siyang hot flashes, pwedeng magkaroon ng tachycardia, merong sleeplessness, and restlessness. So blood or nutritional deficiency in an organ may cause shrinkage, weakness, and tiredness, thus slowing the normal functional energy. Whereas a deficiency in yin would cause dryness and consequent heat symptoms. So magkaiba po yung deficiency ng yin, blood and nutritional deficiency. All the energy in us, in nature, and all things around us are dominated by yin and yang. So we cannot understand the changes. So wait. But yin and yang are always together and are always relating to each other and always reacting to the changes in each other. So lagi silang nagbabalanse. We must not forget that it is this action and reaction that causes changes in and around us. Therefore, whenever we treat the yin, we should treat the yang as well. So pag trinit natin yung yin, i-treat din yung yang para mabalanse. When we treat a yang disease, we must take the yin into consideration too. Okay? So, yin and yang, itong symbol. The symbol is a visual depiction of the intertwined duality of all things in nature. So, nagbabalansi po siya yung yin and yang. Yin and yang, the ancient symbol of harmony, remind us that life is a balancing act and most fulfilling when we learn to embrace its dualities. Yung ups and down, good times and bad, joy and challenges. So yan po yung yin and yang. Thank you po for listening.
Thank you very much, Sir Dino. That was very inspiring. So we should all be prepared for the worst and the best. Okay, so we need to embrace the ups and downs, diba? Yun ang yin and yang duality. Thank you so much. Now we proceed to the 5 elements. For this afternoon, we shall be discussing the sequence and relationships. So we have here both the Shang and the Ku cycle. So Shang cycle is also known as generating or promoting. So magkakaroon ng pathology if there is failure to nourish the sun. No? So for example, if you have the earth element that cannot nourish the metal element, no? And it draws from the mother. So if the sun will draw energy from the mother, so there is definitely pathology. So it's basically parang it's hindi siya nagno-nourish actually, no? So nag-o-opposite. So for the co-cycle, which is controlling the grandmother, grandson, if you remember, nagkakaroon ng pathology if there is overacting and insulting. So let's take a look at and let's compare the generating from the controlling. So you just have to take note of the arrows. So sa generating cycle or the shang, tuloy-tuloy, like it's like a mother and son relationship, whereas in the controlling cycle, we have a grandmother-grandson relationship. Okay, pathological sequence. The first one is the insulting cycle. So this is where the controllee actually fights back, no? So for example, if you have a very, like wood is supposed to be controlling the earth, no? So pag mahina po si wood, instead of the wood controlling the earth, it is now earth controlling the wood because nga deficiency wood. So that's what you call insulting. And being deficient, this will now fail to nourish fire, obviously. So we have here a mother who is unable to nourish her son. The other one is overacting. So this is like the over-controlling. It draws from the mother. So for example, we have an excessive wood. It overacts on the earth. And the water will draw from the wood. Okay? So kasi excessive nga si wood. Of course, the flow of the energy would be from the one that is of a greater, of a higher gradient to the lower gradient. Diba? So let's take a look at the pathological influences. For example, is the liver. Sa totoo lang, there are so many cases that involve the liver in our clinical practice. No? So let's take a look at the liver deficiency and also liver excess, puro wood. So for liver deficiency, the heart, kasi nga the heart is, so it's negative, so the heart will be drawing from the liver. Because liver is deficient, it cannot act as a mother. Okay, so the liver or the wood is supposed to control the earth. So this time, it's the earth insulting the liver because nga mahina po si wood. Okay, spleen insulting the liver. If like with regards to its relationship to metal, the lung will now be overacting on the liver because nga the controllee, the one who is acted upon, is so deficient. Okay, and if you have the relationship between the wood and the water, if the liver is very weak, if the wood is weak or very deficient, the kidney will fail to nourish the liver. Kasi if you remember, the liver and the kidney, they have a give and take relationship, diba? So like the liver will have to depend on the it has to give back to the kidney, it has to nourish the essence, and the same way as the kidney is supposed to provide the yin to the liver or the blood, but in this case you have a very weak liver, so you cannot expect the kidney kasi nga walang natatanggap from the liver. Okay, I hope that makes sense. Now let's go to liver excess. So syempre fire. Yeah, of course, but there's too much liver energy, so there would be a lot of fire. So there's no like sobra, no? For the liver and the wood and the earth, if you have too much of the wood, we have wood overacting on the earth or liver overacting on the spleen. So you would be expecting weakening of the spleen. So there would be symptoms that are that go with it. And then we have the relationship of excess wood to metal. So metal is supposed to control the wood, but this time the wood is so excess. So the lungs will now be unable to control the liver. And finally, liver excess, relationship to water. So you will have liver drawing from the kidney. Okay? Kasi sobrang init ni liver. So that means it's a one-way thing, no? So mas nade-deplete yung kidney yin. Okay, so I hope that was not too difficult. Okay, so here, this is actually a summary of what we should all be focusing on, especially when we try to determine what is really the imbalance. No, all of these elements are present in the person. It's just that as we grow older, nagkakaroon na ng imbalance. So we would rank the elements according to its strength. No? Of course, number one, like whatever you see, for example, if you have a liver person, it should be tall and slender, beautiful eyes, very ambitious, very forward driven. However, if there is some imbalance, you would see a person who is so irritable, whose blood pressure is high, the voice is too loud, yung mga ganon. So I think this just deserves, this is one slide that you need to really, treasure, because this can guide you with your diagnosis. Okay, and at the same time, with a proper diagnosis, you can formulate the pattern and also determine the treatment principle so that the patient will benefit. Okay, so to make it more interesting, you might want to take a snapshot of this this slide. This is where we get to score ourselves. So with regards to the kind of or the element that is so preponderant in our personality. Okay, we don't have to discuss each one of this. It's just that if you have this is a way of really determining what your best element is and what is the worst. Since all these elements are present in us, so we will have to rank the elements from 1 to 5. So yung pinakamababa mo na score will be the last one. And it's probably something that's very concerning, something that you have to really put a lot of effort in trying to bring back to balance. Whereas yung nasa una, ito yung medyo mga positive qualities mo. So I don't think we need to really discuss each and every quality of the element. It's now up for you to just take a snapshot or a screenshot so that you can have your own copy. Okay? Maraming salamat po, and I hope you learned something from today's presentation on the 5 elements. Up next is types of Qi, and we will call once again Ma'am Teresita Sumile for the presentation. Good afternoon ulit, Ma'am Teresita.
Good afternoon po ulit, Dr. Hector and classmates. Type of Qi. 6 days na po tayo. Qi is the motive force. Original Qi is dynamic motive force that arouses and moves functional activity of all organs. It does so because, like essence, it is foundation of vitality and stamina. As form of Qi, it circulates all over the body in the channels. Link between essence, more fluid-like related to slow, long-term cycles and changes, and day-to-day Qi-like related to form-term cycles and changes. Basis of kidney Qi. Original Qi is basis for kidney Qi, closely related to all kidneys' functional activities. Original Qi dwells between 2 kidneys below umbilicus at gate of life. Thus, original Qi is closely related to gate of life and shares its role of providing heat necessary to all body's functional activities. It facilitates transformation of Qi. Original qi acts as agent of change in transformation of gathering qi or zong qi into truth qi or zen qi. This is one way in which kidneys, where original qi arises from, participate in production of qi. Conduit for triple burner. Original qi is the motive force situated between two kidneys, life-giving root of 12 channels. Triple burner causes original qi to differentiate for its different uses around the body. Original qi passes through 3 burners and then spreads to 5 yin and 6 yang organs in their channels. The places where the original qi stays are the source of yuan points. Triple burner is special envoy that transmits original qi. Facilitates transformation of blood. Original qi facilitates transformation of food qi or gu qi into blood in the heart. This is one way of which kidney participate in the production of blood. So dito makikita natin na ang food qi transformed by the spleen goes to the lungs, then goes to the heart to form blood. Okay? Comes out of source points. From its origin in between two kidneys where gate of life resides, original qi passes through triple burner and spreads to internal organs and channels. The places where original qi stays are source yuan points. Next po. The following list summarizes nature of original qi. Original qi is like essence in qi form. It originates between the two kidneys. It is derived from the pre-heaven essence. It is constantly replenished by the post-heaven, the gate of life or Mingmen. It relies on the transporting function of the triple burner to circulate throughout the body. It circulates in the channels to emerge at the source points. Okay? How can the original qi be treated in acupuncture? There are 3 ways. Number 1, needling source points on 12 channels. Number 2, needling and applying moxa to points on the recting vessel below navel. That is REN 7, REN 6, REN 5, especially REN 4. And then number 3, needling and applying moxa to do 4, which corresponds to place from which original qi originates. The following list summarizes nature. Clinical note. The source of U or yuan is important to tonify the internal organs. Kidney 3 for the kidneys, liver 3 for the liver, heart 7 for the heart, spleen 3 for the spleen, and lung 9 for the lungs. Functions of original qi. It is the motive force of all physiological activities, is the basis of kidney qi, helps transformation of gathering qi into truth qi, helps transformation of food qi into blood, and comes out at the source or yuan points. Yun lang po. Thank you so much for listening.
Thank you very much, Mom Teresita. Up next is Sangfu Organs, to be presented by Mom Needs You. Good afternoon, Mom Needs. Ay. Okay, nawala si Ma'am Nitz. I think she has a problem with her connection again. So I think I need to take over. Our topic for Zhangfu organs is kidney, specifically kidney yin deficiency. Kidney yin is fundamental for the yin in the entire body. And kidney yin deficiency frequently causes yin deficiency in other organs. Kidney yin deficiency can cause heat. So it can cause heart fire or even liver fire. Since kidney yin nourishes kidney yang, kidney yin deficiency can appear in combination with kidney yang deficiency. This dual pattern is commonly encountered. So what we usually see in the clinics would be a combination. It's just that one will predominate. Cardinal symptoms of kidney yin deficiency. Okay, Ma'am Nitz, nakabalik na? Are you okay with your signal? Okay, while waiting, we're going to... Okay, just let me know, Ma'am Nitz, if you could already come in.
Okay na, Doc?
Yeah, cardinal symptoms na po tayo.
Okay po. Medyo kumukulog-kulog lang. Pero
Okay.
yung sounds ko okay naman. Okay po, sige. Good afternoon again. So, nasa cardinal symptoms na po tayo. Ito ang mga symptoms: night sweat, dark scanty urine, dry mouth at night, aversion to heat, tidal heat, warm feet, 5-center heat, red cheeks, vertigo, forgetfulness, sexual overexcitability, restlessness, nocturnal emissions, lumbar pain better with cold, seminal emissions, tinnitus, deafness, red or cracked tongue. Yan po. Cardinal symptoms. Then let's go to pathogenesis of selected symptoms. Vertigo, slowly incipient or slight. Kidney yin feels sufficiently nourished and fill brain with marrow. Yun, kaya nagkakaroon noon. Forgetfulness. Kidney yin feels sufficiently nourished and fill brain with marrow. Kaya nagkakaroon yan. Then, deafness, pagkabingi. Kidney yin fails to nourish the ears. Kaya nagkakaroon yan. Okay? Night sweat, yun yung defense way chi circulates on body surface during the day. Moves back into yin organs at night. Kidney yin deficiency causes internal heat to increase. Okay? During the night, internal heat is reinforced by defense way chi, driving body fluids out of the body. Okay. Dry mouth in the evening, kidney deficiency, yung moistening function cannot be maintained. Okay, yan na yung dahilan. Dryness of mouth is more noticeable in the evening because yang moves into yin at night, and therefore internal heat increases at night and dries out body liquids. Parang ako yan. Okay? 5-center heat. 5 centers, yung 5 hits. Sa soles of the feet, the palm of the hands, the center of the chest. 5 po yan. Cooling function of kidneys restricted due to kidney deficiency, and yang excessively warms the body. Okay? Aversion to heat. Because cooling function of kidney is restricted due to kidney deficiency, and yang excessively warms the body. Since internal heat has increased, external heat can be less tolerated. Ang init-init ang pakiramdam. Okay? Restlessness. Spirit is not rooted due to kidney deficiency. Yan. Okay? Pain in lumbar area. Bones lack nourishment and support provided by kidneys yin. Yan, masakit. Okay? Bone pain, masakit yung mga buto. Bones lack nourishment and support provided by kidneys yin. Okay? Sexual over-excitability. Yung activity of yang dominates in kidney yin deficiency. Okay? Nocturnal emission. Deficient kidney yin is not able to restrain yang at night. Kaya nagkakaroon yan. Okay? Seminal emission. Activity of yang dominates in kidney yin deficiency and sexual overstimulation takes place. Okay? Dark scanty urine. Body fluids decrease in kidney yin deficiency and it concentrates in urine. Kaya dark. Okay? Osteoporosis. Yung bones lack nourishment and support provided by kidney yin. Yan, kakaroon ng osteoporosis. Healthy bone isa weak bones. Thank you for your attention, everyone. Kahit na medyo kumukulog. Thank
Ay,
you po.
kumukulog na. Wow, Philippines talaga, no? Grabe. Sige, ingat po kayo dyan, Ma'am Nitz. Thank you so much. At least nakahabol. Okay. Thank you very much. Next, we go to meridian or channel theory. And let's listen once again to Sir Dino Pinero. I hope the weather in his place is okay. Kumusta po, Sir Dino, dyan? Hindi ba pumuputok pa yung bulkan?
Sobrang mainit dito, Doc.
Ay, okay. Kumusta ang mayon?
Ano pa rin siya, active.
Okay. Good
Pero
luck.
hindi naman kami affected, Doc.
Okay, good.
Okay, continue po tayo sa applied channel theory 132, diagnosing via the channels. Okay. Having described the basic tendencies of the channel in the presence of disease, the practitioner is now ready to begin the process of developing skills to observe those tendencies. When palpating the human body, the practitioner is faced with the question of whether what they feel is normal or abnormal. So, kailangan po natin ma-distinguish kung alin po yung normal sa abnormal. Patients are in fact variable and a wide variety of things will be discerned when one palpates the channel. Moreover, there are types of nodules and fatty deposits that are unrelated to the pathology. So, minsan may nakakapa or napalpate na nodules and fatty deposits hindi naman related sa pathology. Over time, however, common patterns of irregularity will begin to emerge and certain types of noticeable change will correspond to suspected organ pathologies. So, kung meron pong pathology or invasion ang patient, over time, magde-develop po siya ng mga changes. In order to distinguish between changes that are significant and those that are not, a certain criteria should be kept in mind. So we have criteria. Changes should generally meet at least 2 of the following 3 criteria in order to be considered significant for the purpose of channel diagnosis. So kailangan po natin at least 2 para ma-consider po na related yung changes dun sa pathology ng patient. First, there should be changes should be in clear line along the specific channel pathway. So kung may ubo-sipon, pag-change natin sa lung channel, doon tayo makakahanap ng mga changes. Next, changes should have some connection to the disease symptoms. So yung nakita po nating changes, connected or relevant dun sa pathology or invasion sa katawan ng pasyente. In other words, they should come and go with the ebb and flow of other symptoms. So related po dapat. As noted above, the channel changes may not occur at exactly the same time as other symptoms and may appear before or after. So, pwede po yung sign and symptoms before pa man magkaroon ng changes sa patient, pwede na pong lumabas or pwede ito lumabas after ng condition. For this reason, careful record should be kept about what palpation reveals at each patient visit. So we should record kung ano po yung na-notice natin, and each visit, i-check po natin kung may changes. Kung may lumabas or yung lumabas nag-improve. So we need to check and record those changes sa every patient visit. Number 3, changes should be located bilaterally. One side may, however, be significantly more affected than the other, especially in those conditions which are situated more in the channel than in the organs such as pain. So check po natin left and right, and one side could be affected more than the other. Observe changes like lipoma, neuroma, moles, canker sores, pimples, tinea, and melanin irregularities like freckles that do not meet the above criteria fall outside the scope of channel diagnosis. So, ito pong mga ibang lumabas na hindi naman related, so i-exclude po natin sila sa channel diagnosis. Changes of this type are better considered in the context of dermatology in Chinese medicine. So, dun po siya i-consider. Sa 5 method of channel diagnosis, now we consider the types of changes that are considered relevant to channel diagnosis. It is important to note that there are actually 5 categories of classical channel diagnosis, of which the channel palpation is but one. So first, we have yung observation of channel pathway. Yun po, isa yun. Then yung pulse diagnosis, palpation of channel pathways, pressing of points, and feeling the body surface. So lahat po ito dapat ma-observe natin. The first 4 of these 5 methods were mentioned in our discussion in the inner classics sa chapter 3. In the modern clinic, all 5 methods are quite important. So lahat po sila importante. In this context, however, we will focus on relatively underutilized technique of palpation of the channel pathway. Discussion of the first 2 methods can be found on Appendix 4. The other 3 methods are combined below in a general discussion of manual diagnostic techniques. So, tandaan po natin itong 5 methods. So, palpation, pressing the points, and feeling the body surface. Although classical sources distinguish 3 separate techniques of palpating, pressing, and feeling, in actual practice, they overlap. These techniques were first introduced in the inner classic and discussed further in the classic of difficulties. The famous 3 Kingdoms period text, the systematic classic compiled by Yuan Fu Mi between 215 and 282 AD, refines the technique of palpating along the channel and discusses the relationship of channel changes to disease. In chapter 12, Yuan Fu Mi asserts where there is disrupted movement in the channel, there is a disease. So kung merong changes, there could also be a presence of disease. From this one could go on to say that when the practitioner discerns disrupted movement or change in particular channel, it is somehow involved in the disease at hand. Sa chapter 14 of our text, however, we will consider the idea that the channel with palpated changes may not actually be the best for treatment. The fact that palpable channel changes can be found is one reason why practitioners of Chinese medicine attach such importance to the simple process of taking one's hand and placing them on the patient to understand the condition of the body. This seemingly obvious prerequisite to a clear understanding of a patient illness is sadly absent from many modern clinics. One often hears about how little physical contact modern physicians have with their patients, but unfortunately, the same is true for modern practitioners of Chinese medicine. So, sabi dito, importante po na ipapalpate, i-check, which is minsan hindi na po nagagawa. To know the condition of the patient channels, one must begin by laying one's hand on the body. So, kailangan ipalpate, i-check natin. Taken together, the three manual techniques describe a process of moving along the course of the 12 channels with one hand. So, ang ganda lang po. Thank you for listening.
Thank you very much, Sir Dino. We will now go to the last but not the least topic, still on bleeding. For this afternoon, we will talk about bleeding under the skin. Bleeding under the skin consists of bruising and is common in old people. In young people, it occurs in leukemia. Bleeding under the skin also occurs at the blood level stage of an acute febrile disease when it indicates blood heat. The patterns that we shall discuss are blood heat, yin deficiency with empty heat, deficient qi not holding blood. Let's talk about blood heat. In blood heat, you will see bright purple spots under the skin, bleeding from the nose, intestines, or bladder, mental restlessness, fever at night, and thirst. The tongue is red without coating, red points all over. The pulse is rapid and fine. This represents the blood level stage of an acute febrile disease indicating blood heat. It is always a serious condition. It may also occur as a chronic condition in old people with blood heat deriving from liver fire. In such cases, there will be no fever. So treatment principle, cool blood, resolve toxin, stop bleeding. Points should be needled using the reducing method. Li11 and spleen 10 will cool the blood and stop bleeding. Kidney 2 and liver 3 cool the blood. Liver 3 also subdues the wind, which is likely to appear at the blood level of a febrile disease. Spleen 6 cools blood and nourishes yin. Spleen 4 controls the blood connecting channels and stops bleeding under the skin. Liver 5 also stops bleeding under the skin. Then we have yin deficiency with empty heat. Clinical manifestations, you will see scarlet red spots under the skin. Bleeding from the nose or gums, malar flush, mental restlessness, dry mouth, 5-palm heat, feeling of heat in the afternoon, and night sweating. The tongue is red, no coating, red points all over. The pulse is floating empty and slightly rapid. This is a chronic condition in old people with yin deficiency of the kidneys and empty heat agitating the blood. Treatment principle: nourish yin, clear empty heat, stop bleeding. Points are needled using reducing or even method, except for kidney 3, kidney 6, Ren 4, and spleen 6, which should be reinforced. No moxa. Kidney 3, kidney 6, Ren 4, and spleen 6 nourish the yin. Kidney 2 and liver 3 cool blood. LA11 and spleen 10 cool the blood and stop bleeding. Next, deficient qi not holding blood. Clinical manifestations. You will see pale red spots under the skin, exhaustion, depression, pale face, no appetite. Tongue looks pale, pulse is weak. Treatment principle, tonify spleen qi to control blood. Points should be needled using the reinforcing method. Stomach 36, spleen 6, Ren 12, bladder 20, and bladder 21 will tonify stomach and spleen. Ren 6 consolidates qi in the lower abdomen to stop bleeding. Spleen 10 stops the bleeding. Lung 9 tonifies the qi, and spleen 4 stops bleeding under the skin. Thank you very much for your attention. Good afternoon, everyone.